Hi, guys. Greetings from Better Man Clinics, and welcome to Ask the Expert, the segment of the program in which actual questions from our viewers and listeners are answered by the foremost experts in the field. Today's question comes from John in Seattle, Washington. John asks, are chondroitin and glucosamine useful in managing chronic knee pain? In order to answer John's question, we turn to Dr. Eric Ziegen, Chief of Joint Replacement Surgery at UCLA. Here were Dr. Ziegen's thoughts on using chondroitin and glucosamine to manage chronic knee pain.
I mean, it's a huge industry. I mean, there's tons of money spent in the United States on these products, and there's a lot of hype about it. And it's been studied pretty extensively. If you look at the data, it's very soft. They've done a lot of systematic reviews and meta-analyses looking at all the different studies out there, and there's some suggestion that if you take the stuff for like 3 months or more, you may see a very mild improvement, but again, it's a soft call. I think when we look at data and we're talking about statistics, something can be statistically significant in terms of there being a difference between these remedies and, say, a placebo. Mm-hmm. But is there a meaningful clinical difference when you look at some of the scoring systems that we use to really objectively say, is somebody's knee pain better or worse than placebo? And there's really no clinically meaningful difference. Mm-hmm. So when you look at the guidelines put forth by the American Academy of Orthopedic Surgeons, the glucosamine and chondroitin sulfate are not recommended for use for severe osteoarthritis of the knee.